Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop knee pain. But before I do that, we'll go over the symptoms of knee pain, causes and risk factors, and how to get to the root cause of the knee pain and address it at home. So the knee joint is very complex joint. There's a lot of things could go wrong at the same time. So symptoms of knee pain, you're probably gonna feel stiffness. You're gonna feel or notice some swelling, probably around the knee in the front or the back. And also you're gonna feel some instability. When you walk, you might feel your knee buckles or very stiff, and it gives out sometimes with certain injury. And also you might feel inability to straighten your knee, so unable to straighten your knee. So briefly, I'm gonna go over some of the structure of the knee that might have issue with the knee pain. When you look here in this image, you will notice that the knee joint is very complex joint. You have the patella, the kneecap here in the front, and you have the medial collateral ligament, the lateral collateral ligament, you have the meniscus in here, and there's a bursa everywhere, and there is the quad muscles, the hamstring. There's a lot of tissue that could have issue in the knee. So I want to show it to you here in the model. This is the front of the knee, and we have the quad attached here all the way to your hip, and then attached to the patella tendon, and all the way down to the kneecap in here. So this is a patella. It's right in here, your patella, and side of the knee right here. And you have the lateral collateral ligament, the medial collateral ligament, and we have the meniscus. Actually, you can see it here, the meniscus, the blue tissue here, and we have the ACL and PCL ligament inside. So you might have issues with the tendon and the ligament around the knee, the meniscus, the bursa around the knee. We have bursa as a cushion between the tendon and the bone, so to prevent any inflammation or rubbing the tendon over the bone. We have bursa everywhere, and also we have the IT band attached here in the side, the outside, and that's a very common issue here. And the hamstring is also common issue when you have tightness in the muscle around the knee, imbalance that could cause the joint to really kind of like, I'm exaggerating here, but it could cause like imbalance in the weight on the knee, and that will start to cause more tear and wear on one side where there is pulling toward that side. So there's a lot could go wrong in the knee, but the normal healing cycle is the same, happen with any of the tissue in the knee, and it will make sense, the treatment, when we understand the normal healing cycle. So what are the causes and risk factors for knee pain? So one of the common cause is IT band syndrome, which actually I have a video specifically on the IT band, and the IT band is attached here, and that's very common to have it tied with a lot of knee issue that could cause bursitis or cause IT band syndrome, and usually very common with the people who are sitting in the desk for a very long time. ACL, anterior cruciate ligament, or PCL, those the ligament inside here, and you can see the PCL here in the back, and those usually injured from a sports injury or falls or something like that. So that's if you have that, that's usually happened from injury or falls or sports activity that cause the damage to the ACL, PCL, or collateral ligament, which is actually the ligament outside the knee from the left and the right. You have the outside, it's lateral collateral ligament, the inside, the medial collateral ligament. Some people could have meniscus issue, and that's usually happen if you are overweight, and that's a risk factor, or you have like a sports injury that you tear the meniscus inside the knee. Actually, we'll have video on that in the future. The other thing that's very common is bursitis, knee bursitis. I have a video on the knee bursitis, but you have bursa everywhere. That's usually inflamed from overuse or trauma or overweight or imbalance in the muscle. Also, you could have tendonitis, which is actually inflammation in the tendon. And you can see there's a tendon here that's very common, patellotendonitis. Here I have a video on that. Also, one of the common things that you have issue with is osteoarthritis. That's usually wear and tear in the joint, and usually happen with overactivity or due to overweight. The other thing that with the rheumatoid arthritis patient, they usually have knee issue, especially when they have severe arthritis in the knee. So those are the list of the causes of knee pain. So what are the risk factors? Risk factors is one of the common risk factors is overweight. The other risk factor is sports activity like skiing, basketball, jogging, or running. And the most common one is muscular imbalance, and we're going to go into detail how to address the muscular imbalance or muscle tightness here in this video, because it's a common with all these issues. Even if you have IT band syndrome, that's usually imbalance in your muscle. ACL, PCL, any ligament or tendon injury, you add to it muscular imbalance, things are going to get worse. So the other risk factor, occupation, like if someone like a plumber or their job required to be kneeling a lot, that could cause knee issue, or a lot of squatting, that could be a risk factor. So how to treat knee pain? In order to answer this question, it's very important to understand normal healing cycle. If you are labeled like you have bursitis, tendonitis, or osteoarthritis, or rheumatoid arthritis, all of these labels based on location of the inflammation, location of the injury, but it does not tell us much about how the normal healing cycle and how to address it. So the best way to really get to the root cause of the problem, understand the normal healing cycle, and based on that, we address the healing cycle, so we get to the root cause of the problem, instead of a stuck of, oh, you have osteoarthritis or rheumatoid arthritis. So it does not tell us much what's going on wrong internally to address it. So normal healing, I'm gonna use external paper cut for visualization, but the same process happen internally with any of those injury. When you have itis, like bursitis, tendonitis, or osteoarthritis, it happened internally, but we cannot visualize it because the skin covered it. So I want you to see that internally. So with normal healing, the first stage of healing is inflammation. And as you can see here in the first image, swelling, redness, the blood start to rush to that area. Second stage of healing is the proliferation stage. That's when your body starts to build a scar tissue. During that stage, there's actually a cascade of events like fascia restrictions, muscle spasm, trigger points. Just gonna focus on the scar tissue for the sake of our time now, but when you have injury, you usually have issue with a lot of these in the list in here in the proliferation stage. So why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, stretch like this. So when you have a scar tissue, it's like you have a knot in the muscle. And when your muscle contracts, it does not stretch much. And when that happens, that's a very classic for muscular imbalance or muscular tightness in the knee joint. When that happens, you will have tightness in one side compared to the other side. For example, if you have the tightness here in the IT band, it's gonna pull your joint toward that side, and you start to have more wear and tear on one side compared to the other side. Think about this way: when you have muscular imbalance or tightness, it's like your car out of alignment. So you're gonna wear your tires more on one side compared to the other side, and you will have issue with that. And that's usually happen with excessive scar tissue or fascia restriction in relation to the proliferation stage. So perfect scenario actually, during the maturation stage, the body gets rid of everything in the proliferation stage and really get rid of the inflammation by itself. That could take days, weeks, months, or years. If you are in a chronic condition, and that's very typical, to be stuck in the inflammation and proliferation stage, your body going back and forth between those two stages. So let's apply this to if you labeled or someone labeled you with the bursitis, tendonitis, or osteoarthritis, what that look like internally. So anything with itis here is actually inflammation, but when you start to have that inflammation, your body internally gonna build a scar tissue, and you start to have a lot of muscular imbalance around the knee joint, and that will cause a cascade of symptoms. If it's in the joint itself and you start to have wear in the joint, they're gonna call it osteoarthritis. If it's happened in the tendon, like patella tendon, they're gonna call it tendonitis, or in the bursitis. Or if you had it in IT band, IT band syndrome or iliotibial syndrome. So as you see, all of these actually a definition for location of the symptoms, but we need to really focus on the normal healing cycle, because understand the normal healing cycle, we're not gonna be stuck in just a location. We're just gonna address the root cause of the problem. So when you work on yourself or have knee issue, we need to distinguish, do you have inflammation or your body going back and forth between inflammation and proliferation? I have a good image here, I wanna show it to you. So normal tissue, like normal muscle, healthy muscle, it should look like this. So when you have injury or tear in the muscle, or usually have the tear like random like this, your body has to have scar tissue in order to heal. So when your body builds a scar tissue, it's actually built it very randomly, like here in this image. The problem is when you have too much of the scar tissue, that cause muscle tightness, cause imbalance in the muscle, and that scar tissue decrease the length of your muscle, and you start to have a lot of other issue with that. So that's exactly what's look like internally from any injury when you have it in your body. So how to treat the root cause of the problem? I'm gonna go over some of the current treatment that actually does not work based on the studies, and we relate that to the normal healing cycle, so it will make sense why this treatment doesn't work. Then after that, I'm gonna go over how to address the root cause of the knee pain by addressing each stage of healing, of the healing cycle. So it's a very common and that's what we learn in the school, to use ice or heat or electrical stimulation for pain. But when we start to look at the efficacy of those modality, a study showed it either provides short-term pain reduction or no pain reduction. So for eyes, they use it for inflammation, which is actually temporarily going to decrease the inflammation, but there's no long-term effect for it. Electrical stimulation, if you're lucky, is going to cause pain relief for half an hour to an hour, but when we look at the healing cycle here, it does not do much to the proliferation stage, does not do much to the inflammation. The other thing is commonly used is foam roller and massage, and I'm going to combine those because based on the studies, they actually do not provide long-term pain reduction. And when I go over the fascia system, it will make sense why this treatment is not effective. But think about this way: you have inflamed knee, you have inflamed tissue internally. If you rub it with the foam roller or with the massage, you're gonna inflame it more, and when you inflame it more, you're gonna build more scar tissue, and that will cause the vicious cycle of inflammation and proliferation. And when I go over the fascia system, it will make a lot of sense. The foam roller and the massage does not release the muscle tightness. So the other thing that's commonly used by physical therapists or chiropractor or other healthcare provider is joint mobilization or joint manipulation or adjustment. Based on a study, does not provide long-term pain reduction. And actually, a lot of studies showed it's not even providing short-term relief. Why? Because when you look at the normal healing cycle, joint mobilization, it's basically just moving the joint. But when we look at the healing cycle here, is that going to make any difference to the inflammation stage? No. Is that going to break the scar tissue? No. You're basically working on a joint, you're not working on a soft tissue. So it's not relevant to addressing the knee issue. The other thing that very commonly used, and I personally do not recommend it to my patient, is stretching. Because think about this way, if you have internal tear in the ligament or tendon or muscle, and you keep stretching that muscle, you're gonna tear it more. And based on the study, is actually overstretching could cause more damage and actually does not really prevent your injury and actually could cause more inflammation. That's why I don't recommend stretching for my patient, because if your muscle is tight because fascia restriction and scar tissue, you have a knot in the muscle, you keep stretching, you overstretch, you could snap the muscle or cause more tear. The other thing that's commonly used is strength exercises, but if it's introduced in the wrong timing, that's gonna cause more inflammation. So if you have inflamed area and you keep doing the strength exercises, that's gonna inflame it more. And there is much more effective way of addressing the issue, doing function training instead of doing the strength exercises. So how to treat the root cause of the problem of the knee pain? As I said, don't get caught with terminology of bursitis, tendonitis, osteoarthritis, or rheumatoid arthritis. It's the same healing cycle happen in all of these diseases. It's just different location. We just need to know how much inflammation you have, how much the proliferation problem that you have, and that's how we get to the root cause of the problem. So first, we need to address the inflammation stage. So what should you do at home? Well, if you are in acute stage, very simple. If you are in the minor inflammation, just give it 5 to 7 days. Avoid the activity that aggravate your symptoms like jumping, running, or kneeling. 5 to 7 days, that should be good enough to help your body to start heal and get it under control. If your pain still exists after 5 to 7 days of not moving or not doing the activity that aggravated, that's indicative of chronic condition, which is your body going back and forth between inflammation and proliferation stage. So what should we do with that? We should address both end of that cycle to really clear it up to go to the maturation stage. So for the inflammation, what I personally use and I give to my patient is the MagnaHeal 2. The magnetic range for the MagnaHeal 2 is about 3 inches. That can be penetrating the body, and I have patient use it if it's a minor inflammation for a few minutes. That's usually good enough to decrease the inflammation. For chronic inflammation or moderate to severe inflammation, they wear the MagnaHeal while they walking or standing or sleeping to decrease the inflammation. The other thing I like to have all my patient on is put them on anti-inflammatory diet. Certain food like refined carb, refined sugar cause internal inflammation after you eat those food for 4 or 5 hours. So certain food is actually cause more internal inflammation and slow down the healing cycle. So I put them on an anti-inflammatory diet. I'll go into detail on that in other videos. One of the other things that's overlooked by a lot of healthcare providers, especially if you have chronic osteoarthritis, rheumatoid arthritis, bursitis, or tendonitis, and your body very slow to heal, there is a possibility of deficiency in minerals, vitamins, or hormone imbalance that actually slow down your normal healing cycle and make you stuck. in between inflammation and proliferation stage. Think about this way: your body needs magnesium, D, B, C, and other vitamins and minerals for your body to move smoothly from inflammation stage to proliferation stage to maturation stage. And if you have deficiency, your body is not going to move. It's just going to stuck back and forth. One of the things that you can do actually right now is go to Ask ASTR, askastr.com. It's a free online medical evaluation. The evaluation takes about 5 minutes, and the software will help you to know if you have possible vitamins, mineral, or hormonal imbalance, and what steps you can do at home to really help to restore those deficiencies. So the other thing we have to address simultaneously is the proliferation stage. So what I do for the proliferation stage, we have to work on the scar tissue, the fascia restriction, muscle spasm, and trigger points. So what I do is I use the A3 to break superficial scar tissue. As I mentioned to you, there's always muscle tightness, muscular imbalance in the knee. Even if you have patella tendonitis or bursitis in here, we have to work on your IT band, we have to work on your hamstring in the back, we have to work on your quads. So we have to address the superficial scar tissue that's all over your knee area and knee muscles to make sure your knee joint work properly. So I use the A3 to release superficial scar tissue, and I use the A5 to release deep scar tissue, trigger points, and fascia restrictions. And going back to why foam roller and massage are not effective, because if you don't have mechanical force on the scar tissue or the fascia restrictions, it's impossible to release it or cause physiological change. Think about this way: if you have, if you want to unscrew a screw in your motor and the screwdriver is short, it's impossible with that screwdriver to really unscrew the screw. So you need to have a long enough screw to really unscrew it, so you will be able to get to your goal. And that's exactly what happened with the massage. We learned in the school to use a knuckle or use the elbow, and mechanically impossible to go deep compared to the A5 to release deep scar tissue, deep fascia restrictions. And actually in the quad muscle, the hamstring, some of the patient actually we can go deep like up to 2 inches, and the only way to do that, we have to have like a tool like A5 to really go deep, to do deep release. So the other thing we have to work on is the fascia. And I'm gonna go over this briefly because it's a very important system to address and extremely overlooked by a lot of healthcare providers. Briefly, I'll go over the anatomy to appreciate the complexity of the system, but don't worry, the treatment very simple. So the fascia system, the superficial fascia layer, it's like a wrap surrounding the entire body. It's like a Spider-Man suit wrapping the entire body. So, and you can see it here in this image, the white tissue here, that's the fascia layer, and also here, and in the cadaver here, the tissue here. So to make things more complicated, we have 2 main categories: superficial layer and deep layer. And the deep layer is divided to 4 subcategories of the fascia, and each of these layers has 2 to 3 layers, as you can see here in this image. So for you can see it here in this image, the apparatic fascia, this is one of the deep layers. The apparatic fascia is wrapped surrounding a group of muscles. And then we have the epimysin, and you can see here the epimysin, it's surrounding each individual muscle. Then you have the premiysin that's wrapping a group of bundle of fibers, and you can see it here, the epimysin. And then at the end you have the endomysin, and that's wrapping each individual fiber. Why this is important to understand? Because we cannot pick and choose, oh, I'm gonna release the apparatic fascia only or the superficial fascia layer, and expect that the epimysin, premiysin, and endomysin will be released. That's what the philosophy of massage or foam roller, working on the superficial layer. but that does not cause physiological change to the deep layer. And because the design of the hand and the foam roller, it's impossible to really cause fascia release with those. So that's what I use the A5 to really go deep enough to release those areas. Why that could cause tightness? If you start to feel like there is a band in your muscle or a knot, or you start to feel like something squeezing on your muscle, that is typically what happens when your fascia is tight. So fascia tightness, it's like you wearing a t-shirt 2 to 3 size too small. Gonna cause the tissue to crumble together, and that's why it's important to release that in the hamstring, quad muscles, and your IT band. Okay, so it's very simple. What I use is the A1 to release superficial fascia layer, and then I use the A5 to release the epimysin, premiysin, and endomysin trigger points to go deep to the tissue. To sum it up, how to address the knee pain, how to treat it. First, if you have acute minor condition, just stop for 5 to 7 days. That should be good enough to get your knee back to normal. Stop the repetitive motion that aggravate your pain, like kneeling, like squatting, like running. Also, if you have to kneel, you can use a knee pad. The other important thing while you're stopping to do that, we need to balance your muscle. Remember, exercises, as I mentioned, and stretch, are not gonna break your scar tissue, are not gonna release your fascia restrictions. To really balance the knee muscular tissue, you have to release the scar tissue, you have to release the fascia restrictions and the trigger points. So if you are, after working on stopping the activity that cause more pain and wearing knee pad, if your pain is still consistent, that is a sign that your body is stuck between inflammation and proliferation, going back and forth. And that's when we have to be aggressive to break that vicious cycle, releasing the inflammation, decreasing the inflammation, and working on a proliferation stage simultaneously. And that's actually sum up how to treat knee pain. If you have any question or comment, leave it in the comment section below, and I will answer it in a future video. I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to astrinstitute.com.